So you or someone you know has recently been diagnosed with celiac disease and you don't know what that means or where to start. That's what I'm here for. I'm Cynthia, I have celiac disease, and I'm here to give you the tips and tricks to make your transition into the gluten-free and celiac lifestyle easier for you. Let's start off with the basics. What is celiac disease? Celiac disease is an autoimmune disorder where the body attacks the small intestine following the ingestion of gluten. Gluten is a protein, and when someone with celiac disease ingests gluten, the body attacks the small intestine and causes blunting of the villi, which are finger-like projections in the small intestine that help with nutrient absorption. So how did I get celiac disease? That's not fully understood, but what we do know is that celiac disease is a genetic disorder, meaning that following a celiac disease diagnosis, first-degree relatives such as parents, children, and siblings should also be tested because their chances of having celiac disease are increased. Celiac disease has over 200 symptoms that range from localized digestive symptoms to systemic symptoms. These often reflect nutrient malabsorption due to the blunting of the villi in the small intestine. Common symptoms of celiac disease include diarrhea, steatorrhea, or fatty stools, abdominal cramping, bloating, and weight loss. Other symptoms include constipation, anxiety, depression, weakened bones, weakened tooth enamel, recurrent canker sores in the mouth, chronic fatigue, migraine headaches, joint pain, and itchy skin. There is something called a celiac rash, or dermatitis herpetiformis, which is an itchy, raised area on the skin. Other signs include iron deficiency, anemia, and other nutrient deficiencies due to the lack of absorption in the small intestine. In children, it is common to see failure to thrive or stunting of the growth. If any of these symptoms sound like something you or someone you know have been going through, there's a link that is a celiac disease assessment tool that you can feel free to use. Because of the variety of ways that celiac disease presents, it can be very difficult for physicians to diagnose. To begin diagnosis, a blood draw is taken, and this is tested for specific proteins called antibodies that are created when a person with celiac disease eats gluten. These antibodies are going to be increased in someone with celiac disease. With a positive blood test, then an endoscopy happens, where a physician will put a scope down your throat and look for obvious signs of damage of the small intestine, as well as take a biopsy to confirm the diagnosis. Exceptions to the endoscopy include patients that tested positive with both serology and biopsy-proven dermatitis herpetiformis, or the celiac rash. Ideally, testing for celiac disease happens when a patient is on a full gluten diet, as people who go on a gluten-free diet with celiac disease will no longer have the increased antibodies in the blood. Celiac disease is treated by a gluten-free diet and lifestyle. People with celiac disease have to avoid gluten in their diet as well as in the air. Some people with celiac disease opt to see a dietitian so they can get a more personalized approach and get help with transitioning into a gluten-free diet. If a person with celiac disease doesn't follow a gluten-free diet, serious health problems can occur. Not following a gluten-free diet can increase the risk of gastrointestinal cancer in those with celiac disease. Lymphoma, although uncommon, can also be a complication of celiac disease that is prevented with a gluten-free diet. Gluten is a protein found in wheat, barley, rye, and triticale, a hybrid of wheat and rye. It is used as the glue in many foods and helps foods keep their shape. Wheat is commonly found in breads, pastas, baked goodies, cereals, and it can be used to thicken soups, sauces, salad dressings, or in roux. Barley is often found in malt drinks, soups, and beers. Rye is found in rye bread, rye beer, and cereals. Another sneaky source of gluten can be in oats, as cross-contact with wheat, barley, or rye can often occur during the growth process. It is important to use oats that are labeled as gluten-free, although some might react to even gluten-free oats because of a protein in oats called avenin that is very similar to gluten. I'm sure this is very overwhelming, and that sounds like a lot of food that you can't eat. I felt the same way 7 years ago when I was first diagnosed. Something that helped me in those early days was to focus on the foods that I can eat instead of the foods that I can't eat. With that, gluten-free foods have come a long way in the past 7 years since I was diagnosed. There are a lot of substitutions that taste just as good gluten-free as they do in the gluten-containing alternative. For more information on the celiac disease lifestyle, go ahead and check out my next video, which will be about my transition into the celiac disease lifestyle and give you more tips and tricks on how to make your transition easier.